Let's get both sides of this fight from Republican Representative Marsha Blackburn of Tennessee and Democratic Representative Chris Van Hollen of Maryland. Chris Van Hollen, let me go to you first. Now, this 8% figure, we've been talking about this. A lot of companies pay more than 8% on their employees. So if they just punt and say, hey, the heck with it, we're not going to offer our employees anything, let them go government, they could actually save money. A lot of companies could save money if they just pay that 8% or let the employees go to the government plan. So doesn't this encourage a lot of companies paying more than 8% to just leave it to the government?
Well, first of all, under the plan, in order for companies to make that decision, they have to, as you said, pay 8% in. For those who are paying more, there's a limitation in the bill that does not allow this to happen, number one, all at once. And number two, we have to ask ourselves, why is it that these companies are paying for health care? It's because they are providing a benefit to their employees. So at the end of the day, however this washes out, those employers are going to be providing the same overall benefit and compensation package to their employees. After all, that is what the market is bearing right now. So exactly what mix that takes in terms of compensation or health care is something to be sorted out. But just let me very briefly say that this tracks President Obama's plan to bring down the costs of health care. And there's a lot of talk about this government plan. It's very important to understand that in the exchange, people will have a menu of options, mostly private plans, and if people choose to take the public plan under a level playing field, they can make that choice, but that is left entirely to the individual. Nobody else is making that decision for them.
Representative Blackburn, there are a lot of companies out there that are wondering, why are we even offering that benefit anyway? In the first place, a lot of countries never have had, private employers doing that and subsidizing it. But what do you worry is going to be the byproduct of something like this?
Well, Liz, one of the things that we see, as you will hear in this debate, nobody says this is going to end up being something that saves money. Everyone knows it's going to cost more. And that is why there's so much discussion about how this is going to be paid for. Now, in Tennessee, we had the test case for Hillary Clinton health care back in '94. It's a program called Care. It was put into place in our state at that point in time. Soon it was eating up every new dollar that came into the state. A Democrat governor had to go in and remove 170,000 people from the rolls. In Tennessee, we know that the public plan, the government-run, government-financed plan in competition with the private plan, it doesn't work. You can't afford it because the cost is not containable. So what we're concerned about is looking at that and the fact that it leads to rationed health care. And you can look at what has happened in Tennessee. It is a great study in why you don't want to do what the Democrats are trying to do at this point in time to health care. It's going to ration care. It moves it further away from the patient. It keeps the patient and their doctor from having the opportunity to make those decisions.
Yeah. Well, Congressman Van Hollen,
if I can respond to that.
If I can just move on, though, there's a specific question a lot of Americans want, sort of pulling back a little bit and saying, okay, if the government is a lot more involved, when has the government ever made things cheaper and more efficient by getting more involved?
Well, I think we would all agree that right now, people who are paying insurance are having to pay essentially a surtax on your premiums to pay for the 43 million Americans who don't have insurance. When they show up at the hospital and get the care in the hospital room, we're all paying for this right now. So to the extent that we can provide coverage up front and get the preventative care they need, it will bring down premiums. The President has been very clear. This is about reducing the cost of health care, and you do that by bringing everybody into the tent going forward. So that is the goal that the President has set out. The fact of the matter is, when you talk about the costs of trying to cover additional people so that premiums can come down, the President has identified over $500 billion in efficiency savings in some of the existing programs over a period of time. That's Medicare. And so that will pay for at least half, under the President's plan, of the costs of getting the system up and running. But again, where individuals will see their savings is when their premiums go down, because they're no longer having to pay what is essentially today a surtax that you and I and Marcia and all of us are paying because
David,
of the additional costs.
let me say something here.
Go ahead.
Here again, you can look at what has transpired in the state of Tennessee. This doesn't work. They're talking about theory, and when you put it into practice, it doesn't work. What happens is this. Number one, the cost from the public plan gets shifted to the private plan. Those costs go up for individuals on private plans. Then many employers will move people to the public plan thinking, well, I can no longer afford to provide this insurance. Then you see access to care restricted. You see rationing take place. This is something we know what is going to happen. In the end, it becomes very expensive. It is too expensive for government to afford, and people get less care.
Okay, we're going to have to wrap it there.
Fair and balanced.
We would argue that you don't really know what's going to happen, and that's why we're covering every step of this as it goes along. We know something must be done. We'll be watching it too.
Marcia Blackburn, Chris Van Hollen, thank you both. Please come back and see us again.
Absolutely.
Thank you.
Appreciate it. Well, is this latest health